All right. So it's now 1 p.m. Eastern Time, so we'll begin this webinar. It's a pleasure to welcome you all to this webinar. We'll be sharing all latest findings on the mental health of Canadians from our 23rd national poll. So I'm Claire Lavasek. I'm the coordinator of partnerships and strategic initiatives here at Mental Health Canada, Research Canada. But before we proceed, I would like to begin with a land acknowledgement. Next slide, please, Michael. Thank you. So as we are a national organization, our work impacts many lands in Canada, but I am welcoming you from the city of Toronto, which is located in the traditional territory of many nations, including the Mississaugas of the Credits, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples, and we are most grateful for the use of this land. Next slide, please. Thank you. So if you're not familiar with Mental Health Research Canada, we are a national charity dedicated to improving the lives of Canadians by advancing mental health knowledge. We believe that the enhancements of mental health services should be evidence-based, and we contribute to the mental health landscape across Canada. One way we do this is through our national polling initiatives, which we'll discuss in this webinar. And this initiative allows us to monitor, analyze, and report on the mental health of Canadians. And it's a project that is supported by Health Canada. So a few words about what defines our polling works and maybe what makes it special is that our research is timely as we conduct quarterly national surveys. It's also comprehensive as 4,000 Canadians participate to each poll. And so far we've collected responses for more than 80,000 Canadians. It's also collaborative as we design our surveys in consultation with people with lived experience, other mental health organizations, and research experts. But perhaps what makes it most special is that it's shareable. And our dataset is freely available to researchers, nonprofits, and governments. Next slide, please. So here is a sample of the indicators that we've collected across our 23 national data collections. For those of you who don't have the capacities or the resources to analyze complex dataset, we also provide public reports and a data hub on our website. Next slide, please. So moving on to the agenda, we started with an overview of MHRC and our polling work. I will now cover a few housekeeping items. Then my colleague Michael Cooper will present the major findings from poll 23, and we'll end with a question period. So we do encourage you to submit your questions throughout the webinar in the chat. I'll be monitoring them and we'll try to address as many as possible during the Q&A session. Feel free to write both in English or in French, as yes, you can hear it. I actually do speak French. Next slide, please. So a few housekeeping items. First, trigger warning, we'll be discussing mental health indicators broadly, but we'll touch on some sensitive topics such as suicide ideations or substance dependencies. So if you feel at any point that stepping away would be in your best interest, please feel free to do so. Also, this session is being recorded and the presentation deck that you can see along with the webinar recording will be available after this session. The webinar recording will actually be uploaded to our website. And my last item, that's fine. Please do not hesitate to follow us don't hesitate to follow us on social media, Facebook, LinkedIn, Instagram. But what I wanted to say is please don't hesitate to reach out to us following this webinar if you have any questions or feedback, as it's always very valuable to us to improve our webinars. So now, I'm pleased to be joined by my colleague, Michael Cooper, who is the Vice President of Mental Health Research Canada. Michael has led our polling initiatives for 5 years and is a highly regarded leader in the mental health field in Canada. So without further ado, I now give the floor to Michael.
Thank you so much, Claire. Really appreciate that introduction. Claire, this was your first time doing this introduction. I think you did a fantastic job. And for those who aren't aware, when we talk about sharing the data, one of Claire's primary roles is to work with our data partners, of which I think we're over 80 data partners now that we turn the data over to. And Claire's one of her primary responsibilities, besides putting this deck together and a number of other tasks as well, she does work with those partners in terms of making sure they have access to the data. I do want to frame out our poll 23 results. We did collect this data through February. We did collect it obviously during a time of great upheaval in the world. Of course, we all know about the U.S. tariffs and retaliatory measures, the threats of the 51st state, the resignation of Prime Minister Justin Trudeau. There wasn't a provincial election that was called. And of course, we continue to see Ukrainian war and strife in the Middle East as well, too. So I just wanted to make sure we contextualize this properly. Again, if you have questions or comments, please post them in the chat. My colleagues are watching them. One thing I did want to highlight is that despite all of these challenges, and we were expecting to see an increase in self-rated anxiety, we actually did not find an increase in self-rated anxiety from during this period, which was early on in the tariff war. It was a lot of conversations. There wasn't a lot of actual concrete action at this time. The simple threat of tariffs at the early stage was not enough to drive self-rated anxiety higher during this period. It is worth noting that we did actually conduct an Omni study, which we'll be releasing in the next couple of days, which looked into more detail as to how anxiety was moving, specifically among two populations. The older Canadians who would perhaps understood more about what this tariff and economic war was going to mean for Canada, as well as the fact that it was driving down stock markets. But we also saw a lot of movement among individuals who were already in that high anxiety category, moving to an even higher level of anxiety. So the shift was within that high anxiety, high 8 to 10 on the 10-point scale category. What this really manifested as in our data was that we did see a spike in a couple different indicators. One, the percentage of Canadians who indicated that the ability to pay their household bills is having a negative impact on their mental health went from 34 to 39%, a significant increase, and the highest rate we have seen on this indicator ever. So essentially, what we take away from this is that what we're seeing is the individuals who are struggling most with their anxiety are individuals who are struggling to pay bills. And that's how this tariff economic war is being manifested in the mental health of a lot of Canadians, which is what is the end impact going to be on my ability to afford everyday living, given that we've already gone through a significant cost of living challenge through this inflationary period. This builds on top of that. You can also see that as inflation was coming down, this indicator was going down along with it, and then now it's spiked right back up. Again, this would be a reflection of the same indicator we talked about before, where during the pandemic, the economic downturn was having an impact on people's mental health. There were far more people indicating significantly negative mental health in late 2022. And then as we moved into 2023, it did improve. And so you see this movement, and now you see it spiking back up to sort of late COVID period in terms of the negative impact of the economic downturn. And the other place we noted this manifesting was we asked a question was we asked about a number of activities, and the specific activity, watching, listening to, or reading the daily news, is now having a much more significant mental health impact than it has getting back to pandemic levels in terms of the negative impact of watching the news is getting back towards those pandemic levels. As I said, despite all of this, we did not see the overall mental health indicators of anxiety shifting. And this was a little bit perplexing, again, until we looked into the two groups that were most likely to be shifted in their mental health indicators, which were individuals who had very low anxiety and moved up a little bit, and also individuals who were showing that very high level of anxiety already shifting even more into high anxiety. And the other thing, of course, that we considered, and although we don't have data for this, we did consider that there is, of course, a high degree of resilience among the Canadian population at all times. But the other thing we considered is the protective factors of being part of a community. So we did study, and we do know from many of our studies that being connected to a community, be it a family unit, be it a broader social community, does have a positive indication or positive impacts on your mental health. And one of the positive theories around this is that this nationalism that we're feeling around this economic tariff war is actually driving a sense of community, which is actually a strong protective factor for many Canadians. So here we'll get into the Omni poll, which looked at the movers of mental health, specifically around the issues of tariffs and economic wars. Oh, sorry, we're not getting into the details of this. This will be released in a few days. The overall indicator, as I mentioned, is the populations who moved. Mental health did get worse, but it didn't actually get worse for more Canadians to be in that highest category of anxiety. Other indicators we looked at on this particular poll were screen, social media use, and mental health. We did a look at the number of Canadians who are indicating that social media, such as Facebook, Twitter, and Instagram, are having a negative impact on their mental health. This is the highest we've ever seen it on this particular indicator, at 1 in 3 Canadians indicating that social media is having a negative impact on their mental health. And it is 38% or closer to 2 in 5 when you look at the youth population who've indicated that social media is having a negative impact on their mental health. This does compound with amount of screen time. So we know that individuals who are spending more than 6 hours of the personal screen time are showing significantly more negative mental health indicators. And we do know that when we look at this, there are more Canadians, especially young Canadians, who are spending more than 6 hours a day looking at their screens for personal time. And again, this works in conjunction with that indicator that not only are they spending more time on their screens, spending more time doing social media, but the amount of time they're spending is also leading to more negative mental health indicators as well. And again, this just looks at the individuals with high personal screen time have more likely that they're going to have moderate to severe anxiety depression indicators, especially among young people. They're more likely to have moderate to severe depressive symptoms. These are tracked using the GAD-7 and the PHQ-9. So they're symptom screeners. They're more likely to have suicide ideation compared to the general population. And I'll leave this slide up for a moment for people to take a look. We also did collect a lot of questions pertaining to how people are using social media in terms of what platforms they're using, what sort of behaviors they're encountering, what sort of toxic behaviors they're encountering, and what are the specific things that are happening to them online, which are driving more of these negative mental health indicators. But it was too complex to put in our overall poll 23 results. So we have decided to move that to a research brief, which we'll be working on the next quarter. But some high level stuff that we noticed as well too. We noticed that young people were exposed more significantly to content that might incite hate or violence. We know that they're significantly more likely to experience cyber victimization, which would be threatening or aggressive messages, non-consensual sharing of intimate content, or pressure to share intimate content. And these were some high-level findings we found in terms of prevalence. And then what we have to do next is correlate these specifically to mental health indicators. Another area we explored in detail was the sense of belonging, sense of community, sense of social supports. And then we we did look at the about half of Canadians take part in some sort of a community group, being it sports, recreation, leisure, civic, community, social clubs, professional, political, or religious groups, cultural, education, or hobby type groups. And we do know that people who indicated that they participate in these groups do have a much, it's almost a one-to-one correlation, 97%, who said that they do feel a strong sense of belonging to their local community. So actively participating in those sort of groups does increase your sense of belonging to your community as a whole. We have previously found that individuals who have a strong sense of community have a significantly improved mental health indicators. It's a little bit of a causal, it's hard to know chicken or egg on this one, whether or not their mental health indicators are driving them to not feel a sense of community, or whether or not their sense of community is improving their mental health. We haven't been able to establish causation on this particular one, but we do know that there is a correlation between feeling connected to your community, feeling connected to your family, and having better mental health indicators. Which causes which, we still haven't sorted out yet. At least it's not evident in our data. And again, these are indicators that for individuals who have a weak sense of community, they're far more likely to have moderate to severe anxiety, depression, or mental health distress. Claire, are you there, Claire?
Yes, I'm here.
I just wanted to ask, was there anything you felt I've missed so far?
No, you covered everything brilliantly, Michael.
Thank you. Of course, another area that we've been hearing questions about was what are the correlations of individuals pertaining to family doctor GP access and mental health indicators. So we were aware of StatsCan and other groups who have been collecting an indicator around the percentage of Canadians without access to a family doctor. And I'm happy to report that our numbers are quite in line with other indicators that we've seen looking at the percentage of Canadians who don't have access to a family doctor, with approximately 1 in 5 Canadians not having that access, which breaks down even further to about 6% who said they've never actually tried to have a family doctor, and 13% who are actively trying to get a family doctor but have not done so. Interestingly enough, it was higher in Quebec and Atlantic Canada and lowest in Ontario. So if you don't have a family doctor, we noted that there were significantly higher rates of signs of cannabis dependency, significantly higher rates of alcohol dependency, much more likely to have severe symptoms of mental health distress than the national average. So again, 19% of people don't have a family doctor. But among those with a cannabis dependency, 36% of people with a cannabis dependency didn't have a family doctor. The two things are connected. And the severe symptoms of mental health distress, unless I'm mistaken, that would be from the Kessler Psychological Distress Scale.
Yes.
This is an old piece. This isn't from our poll 23, but we're throwing it in here so that people can know. This is a sunburst graph that my colleague Shauna did. It's an excellent way of visualizing where people would go for mental health supports. And what you can see is that the vast majority of people, 43% of the population said if I needed mental health supports, I'd go to a medical professional. Among that 43%, 74%, so 3/4 of the 43% said that the first stop would be a family doctor. So this was why we were particularly interested in this question, because we know from two different indicators. One, this sunburst graphic that people would go to their family doctor, but also when we look at service access indicators and we look at the approximately 30% of Canadians accessing mental health support or going to a medical professional, we know that among them, family doctor is the most common place they go to as well. So we know from multiple data points that family doctor is probably the most important avenue for a lot of people to get their support. So if they don't have a family doctor, they can't access that support. And of course, then you start having conversations about are they going to end up in an ER or which of course has economic consequences as well, as it's much more expensive than visiting a family doctor. We're really happy in this particular poll that we've started a brand new system to look at substance use supports independently of mental health support. So previously we had a question that said, have you accessed a mental health or substance use support in the past year? We've since built out a skip logic system that allows us to delineate after, if they answer yes to that, was it a substance use support? Was it a mental health support? Was it both? And so we've been able to look at the percentage of Canadians who are accessing just substance use supports or independently of mental health supports. And so again, this question looks like this. 15% of Canadians accessed a mental health or substance use support in the past year. Of those, 14% said that they had accessed a mental health support. So nearly all of those individuals who said that they accessed a support in the past year, almost all of them said it was a mental health support, and only 2% of the general population, or a fraction of that 15%, actually said they had accessed a substance use support in the past year. I think what's interesting to me, though, is the ratios. So, for example, if only 2% of people are saying they're going to Canadians are saying they're going to a substance use support, and 1% said that they should be using a substance use support, ratio wise, that means about a third of the people who need substance use supports are not accessing that support. While, for example, for mental health support, it's closer to a quarter. One thing I do want to highlight here is that because the sample is so small of people who've indicated they used a substance used health support, we can't do a deep dive analysis at a because the sample is too small at this point, but we've committed to keeping this question in for multiple waves of this collection so that we can see in the aggregate when we collect multiple data sets over the course of a year, what this could look like and what sort of analysis we can do to understand this better. And again, I would take all of this data with a grain of salt. As I indicated, it's a very small sample as of yet, but this is what the people who access the substance use support said that they had done, who paid, what they accessed and who paid for it. Again, this is only 65 respondents, so it's too small to be definitive at this point, but we'll continue monitoring this indicator for the next year at least.
Right.
All right, well, I might have gone through that too quickly, but I'm more than happy to take questions. If anyone has any specific questions they'd like to bring forward.
Just very briefly before the questions, maybe I can do a quick recap of what you said, Michael, so that people have it in mind. So we saw a rising, more Canadians saying that they are concerned about the economic downturn and the possibility of not paying their bills, especially in the context of tariff threats that was happening in February. Also, that youth are more likely to spend more time on their screens for personal reasons, and therefore to show negative impacts on their mental health. They are also more likely to be victim of cyberbullying and to be exposed to harmful contents. Another topic we saw is that participation to community group is associated with a greater sense of belonging, which is which is also associated with a better mental health. Another topic covered was that 1 in 5 Canadians don't have access to a general practitioner or a family doctor, but people with mental health or substance use challenges are more likely to lack a GP, which can actually hinder their access to mental health support, given the fact that 1 in 3 Canadians state they would go to their doctor for mental health support. And the last point covered was about substance use access, saying that 2% of Canadians accessed substance use support in the past year, and another 1% said they needed to access substance use support, but did not do so.
So I see some questions here, and I'll take them from the chat first, and then if you have follow-up questions, or if I don't answer your question, please let me know, or if I don't understand it, I can turn on your microphone and we can hear you. Yes, you can have a copy of the slides, and they will be up on the website. Have we looked at a difference between girls and boys regarding screen time? Yes, but I don't know the answer to your question off the top of my head, and I don't know if there's any of my colleagues who are on the line who want to share any of the indicators in terms of whether there's so many indicators, I don't know which indicator you want. Whether or not they've been exposed to toxic behaviors, there was hours of screen time. I can tell you from my recollection of this data when we did look at this, and we do have it in a longer report, that women were more likely to report cyber victimization, or young women cyber victimization, bullying, and the negative indicators of that. But I'm more than happy to be corrected by my colleagues who might have that report in front of them at the moment. But it wasn't in this deck. But yes, there was a difference between gender. And if they want to pull it up and comment on that further, if you had a specific question, cyberbullying, then we can pull that stat for you and let you know.
So if I can add a few words about this, yes, given what the studies that were previously done, it is expected that women, and especially young women, are more frequently victim of cyber victimization. But we also wanted to let you know that we are currently working on a report on this topic that we will release this spring to make a more comprehensive study of screen time, exposure to harmful content, and cyber victimization, which will look in more details at different demographic groups.
Yeah, so in terms of the substance use and accessing support, so the indicator says that overall 15% of people had accessed one of a mental health or substance use support. 2% of Canadians in total had accessed a substance use support. So of that 15%, it represents like 2 divided by 15, was that like 9% of the supports accessed were mental health or substance use supports. I think what's interesting to me on that front particularly is we do track the cut it and the audit scores. So we do know that approximately, and correct me if I'm wrong, anyone on my team, about 5% of Canadians, 4 or 5% of Canadians indicated problematic substance use, be it alcohol or cannabis. And that means that if 5% for alcohol and 5% for cannabis, if you overlap, because there's multiple people in a Venn diagram who overlap that, if it's say 8% of the population and only 2% are accessing help, that's a quarter of the population, and 1% who should be. So that means functionally that more than half of the substance use population in this country who are scoring problematic on an audit and cut it are not even thinking they need help. They're not accessing, and they don't even think they need to access help. So that's where I see the problem, which is we do know that it is a significant problem, but I don't think it's necessarily being identified by the individuals themselves that they need help, regardless of whether they're accessing that help or not.
Just a quick word on that, because it was also the first time that we run these questions. We will refine them as in our future polls, and we will also add some questions about the barriers to care for substance use and why, to try to understand why actually they were not accessing maybe the care that they need.
Last question I see here in the chat. Where do people go on that sunburst graph? And shout out to my colleague, Shauna, who's brilliant when it comes to that graph. Why is it we think that only 4% of people go to their workplaces research? Well, the first thing I want to highlight on that is that only about 55% of the population is working or student. So, your base size on that is not 100%. The base size on that is really only the employed population. So it's not 4% of the employed population, it's 4% of everyone, including retirees and students and so on and so forth. But it's still low, regardless of whether or not we include that population or not. And when we have looked at this in previous studies, what we have just found is that a lot of people did not think their mental health was necessarily correlated to their workplace. They didn't know where to go at their workplace. There is a litany of reasons people don't go to their workplaces. We know mental health data, for example, people prize their mental health data in an incredibly protective way. So the idea of bringing that to your employer or an EAP or even benefits that might get back to your employer could be threatening to some people. So there'd be a host of reasons. We have covered this in some of our workplace studies, but the most common one is basically that um, they didn't think it was their workplace's responsibility, or they didn't really appreciate that their workplace had those sorts of supports in place. It's also worth noting that when you talk about workplace mental health strategies, you see them relatively implemented at big business, but you don't see them as much in SMEs and small medium enterprises. So, there are gaps in workplace mental health programming available as well too. Is the lack of healthcare access driving increases in alcohol substance use? I don't know the answer to that question, to be completely transparent with you. I don't know what's driving the correlation between lack of healthcare access. I do know that there are individuals that not having a doctor makes you more likely to have cannabis, alcohol, or mental health distress. I don't know why, if that makes sense. And I don't know what's causing what.
Michael, there are also questions in the Q&A chat, which is another chat. So perhaps we could address a few.
I'm just going to finish this chat. I got two more, and then I'll go back to the chat later. A rural and urban data. Yes, we have rural and urban data on this. No, it's not in this particular report. We are working on another one that looks at this, and we've refined our rural urban data. We're not just using the FSAs or the postal code data anymore. We're using proximity to an urban center or proximity to a suburban center as better indicators. So there'll be more coming out on that. Yes, it is available. Is there time you can touch on data around perception of employees feeling their psychology? Yes. So we actually did a separate study in 2023 with Canada Life and Workplace Strategies for Mental Health. If you go to our website and you go to workplace mental health in our work, there's the first button there is something called our workplace mental health data tab. And the psychological safety supporting the workplace is one of the 13 psychosocial factors that are part of the national standard. And we do show prevalence rates. We have an interactive tool there that would allow you to see what percentage of employed Canadians believe that their psychological safety is being supported in the workplace, and it's also interactive. So you can sort it by industry, you can sort it by gender identity, you could sort it by equity-seeking group. Caitlin, I would strongly suggest you take a look at that data hub to get answers to your question. Now I will address the Q&A. Thanks, Claire.
So a question is there a preference? Is the preference for family physicians for mental health care due to cost barrier? Do you have data on affordability? And I'm thinking about barriers to care and affordability.
So we could do this because we do have income levels for this, and we could also map it by FICO, by the FSA data. We have not done this. We could do this. We don't have it yet, but the data does exist for this.
We actually have in our Poll 23 maybe a slide on barriers to care, and affordability is always one of the major reasons for not accessing the care that they need. Although we don't have the specific question about are they going to the family doctor because due to cost barriers. But we can say that it is definitely the costs are definitely a barrier.
Yeah, I am misreading this question, actually. I was thinking about the family physician question, but functionally what this is about is the preference for family physicians because there are cost barriers. We do know that cost is a barrier, and we know that through a couple ways. One, we ask people who are not accessing supports, is it because you can't afford it? So we do know that wait times, navigation, and cost are all prevalent within that indicator. We also do know that individuals without access to benefits, group insurance benefits, are more likely to be treating their services differently, less likely to be diagnosed based on that EAP group benefit data we have as well too. So we do know that they do interplay with each other, but I don't have those numbers in front of me in my head at the moment. First time joining one of our webinars. Oh, sure. I see there's a note here that someone wants to connect with us. That's great. Do you want to ask the next question or do you want me to just read it?
As you prefer.
I think I've answered that one. Provinces, yes. So we do collect a representative sample of each province. And then we also do upsamples with some provinces who ask us to do upsamples. So we recently did one for British Columbia, another one for New Brunswick. But I think this particular poll, we just did representative sample of the country as a whole.
We just can note that we increased our sample size to 4,000 Canadians now.
And we'll be even bigger than that on the next one. We're collecting. Okay, there's lots of questions coming in here. Okay, is there anything that surprised me about the findings? I legitimately thought the self-rated mental health and even possibly the clinical screeners around anxiety were going to be up. And honestly, I don't think the data is 100% clear as to why it didn't go up because it feels like it should be going up, especially when you look at some of these other indicators around it. And they're really only two things we've seen, having been doing this work for 5 years and doing this through COVID, is that A, you have to consider the resilience, the protective factors, which I think there are some in this place. And two, looking through this COVID experience we had, we saw the biggest movement in these indicators, not with the threat of something coming, but when something actually had a significant impact in someone's lives. So we would do a data collection where we saw Omicron encroaching as a major threat, as a variant of COVID, and we would think the numbers were going to shift, but they didn't. And then all of a sudden, you'd see a lockdown happen. You'd see that catalyst moment where suddenly we're all back in lockdown, and that's when the indicator shifted. So the threat of something, and it's weird because anxiety really is the fear of the threat of something. It doesn't always manifest until that threat becomes a real thing, and that it's become more real to people, that it's being experienced by more of your peers. So that's what surprised me. Do we have income? Yes, we have income levels for individuals paying bills. It is obviously lower income Canadians are significantly more likely to indicate that the stress around the negative mental health is it's much more representative of lower income Canadians. Have we been able to assess the impact of cyberbullying on youth self-harm? Not yet.
This will be part of the report as well.
Yeah, so we are working on a report on cyberbullying and youth self-harm. Yeah. Okay, you mentioned that those with the biggest increase in anxiety is those with low anxiety and those with high anxiety. Is it right to say that this means those who didn't seemingly suffer with anxiety now do? And as you said, those with high anxiety are now experiencing worse. So I would agree with the second statement, not the first one. What we see in the data, and some of this will come out with an Omni in 2 days that we'll publicly release. What the data shows us is that the individuals who are most impacted by anxiety due to tariffs and taxes are people who can't afford things already, who are already primarily in that 8 to 10 category of high anxiety, And then you also see it manifesting significantly on the 55, those aged 55 plus. And when you look at our data, what you'll see is that not many Canadians over the age of 55 comparatively have indicated high anxiety. So if the average score for people over 55 is like 3.5 out of 10, 4 out of 10, it might move to 5 out of 10, but they're not at that 8 category. So yes, that group of older Canadians who typically have lower anxiety are feeling more anxious. That's the one group. And the other group are the people who were already at an 8 or 9 or now at a 10. And those would be the two groups that we've seen moving, the economic challenges and the older Canadians. Those would be the two most significant movements we've seen. Okay, do you look at what Canadians need to improve their mental health? I know a big factor is access to GPs. Is there anything else that individuals, companies, and government could do? Yeah, I mean, how long do you have? Really, I think that the first thing we need to do is put mental health at parity with physical health. I don't know why we believe that this part of our body is worth taking care of, but this part of our body is not in the same way. So I do think that improving literacy, achieving some more degree of parity of mental health with physical health will go a long way. And I also think that there are lots of things we can do to support our own mental health. We look at things like, as I said, being part of a community. More recently, we've been looking at as the spring weather improves, the effect of going outside. We do know that has a positive impact on mental health. And I think, trying to support your resiliency and your wellness as best as you can to try and be as resilient as possible when challenges come along will go a long way for
It's
a
also,
number of Canadians. Obviously, I'm not talking about those with the most acute needs.
it's also related to another question here. Were there any distinctions between using mental health, medical, professional, conventional mental health services, example, therapy, and other holistic mental health services like community or organization, etc.? And I also want to point out that we will probably add in the near future a question about what helps your mental health the most, so that we do not only capture what supported Canadians' mental health on the professional side, on the mental health services, but also maybe their family supports or their time outside or them exercising in order to have a better overview of everything that supports Canadians' mental health.
Was there distinctions between using medical, professional, conventional mental health services and holistic mental? Yes. So we do have we don't have it in this poll. We have done work previously looking at the type of services, medical, professional, medical community services versus free services, versus ICBT. So we've done a lot of work delineating the different types of services people accessed. I don't know if we did one that was necessarily holistic. It is more along the lines of who did someone work with you? Or was it self-help resource? That was more along how it was aligned. But we've got some papers on our research brief that tell a little bit about how people access services differently in this country. Do I think negative mental health impacts associated with increased screen time is due to less time spent participating in community, other extracurriculars? I do suspect that, because I do know that we see more positive indicators for being out for individuals who indicate they're going outside and doing more of those activities. But I don't know the extent of it because we haven't finished that paper as of yet. And again, we'll do more on screen time in the coming months. So yes, based on initial analysis, scale and degree, TBD. Does the research look at comorbidities and physical health as factors for poor mental health? No. And this is a question that I'm positing in my brain on a regular basis. How to best validate physical health indicators, other than, we do track those who have indicated a physical disability, but how to track things like cancer diagnoses, health. And there are other indicators. I'm thinking of the one that is done at the University of Waterloo with John. There is other indicators and other studies that we don't do that look at that correlation between physical health and mental health. I'm trying to remember the name of it, Claire. The one that the folks at the University of Waterloo did. funded by the Canadian Red Cross. There are other studies that look at this, that look at mental health and physical health together. We don't.
So for those interested, we collected data on chronic pain and
Yeah.
the association with poor mental health indicators, actually.
I see back in the chat here that there's a question about 988. We do collect an indicator about awareness and usage of 988. We don't collect at every poll because it doesn't move quite significantly, but we do know that about 45, 47% of Canadians are aware of 988. And last I checked, it was around 11%, 9 to 11% of Canadians had indicated that, and Claire, I don't want to say something wrong here. It was either that they had used, I think it was like 4% of people said they'd used 988, and 11% of people said they knew somebody who had used 988. But we still, 50% awareness for 988 is actually pretty good. A lot of mental health strategies and from provincial governments, federal governments never reach those kind of numbers. So it's progressing well, and every time we look at this indicator, it moves up a little bit more. So we do know it's being used, and we do know its awareness is there.
So you missed a question, and it's also related to some of the reports that we published recently about the comorbidity between mental health and substance use. So is it common for people to experience both mental health and substance use problems at the same time? What role do mental health support services play in addressing substance use, and should there be more integration between the two areas?
Yes, there's a significant correlation between people who are substance use and mental health. We do have numbers like that in our report in terms of indicating the percentage of people who have alcohol or cannabis disorders, substance use disorders, and also have mental health. So yes, there's a well-proven and established link with the two correlating. What was the second half of the question?
You partially responded. What role do mental health support services play in addressing substance use challenges, and should there be more integration between these two areas?
So, I mean, we're data nerds, and our job is mostly to try and figure out what's happening with these sorts of things, as opposed to, but on a personal level, I can tell you that it's really important that we increase knowledge of substance use services, and mental health services in those respective fields with the other, so that we have more diverse teams that are fully aware of those subject matters. And as we continue to increase awareness of mental health treatments and supports through family doctors, for example, that we also do that for substance use disorders as well. So diverse skills, diverse teams. Yes, I fully agree with the fact that they're highly correlated in those two different sort of support systems need to be better intertwined. And I think for a lot of service providers they are, but I think we can continue to make progress in that space.
There's any question? There are also a few
Do
questions.
you want to answer that French question before I answer the last English one? There's one at the bottom of the Q&A.
Is there a French question you said?
Yeah, at the bottom of the question Q&A.
La somatisation est-elle prise en compte, surtout dans les communautés culturelles?
Claire, can you clarify the question for us so that we know?
Yes, I'm not sure that we collect data about that. It's about somatic symptoms. Are there taken into account? Maybe you could support on the answer of this question.
So, do you know about somatic symptom disorder?
I don't think we collected data on this topic.
Yeah,
so-
no. So I have been asked about somatic symptom disorder in the past, and we don't collect any indicators around somatic symptom disorder. Although I am aware of it because I have looked into this issue. Do you want to answer that in French?
Yes. Nous n'avons pas encore collecté de data sur ce sujet, mais c'est quelque chose que nous pourrons prendre en compte pour les collections futures.
Do we have any data about group homes or mental health, including criminal justice outcomes? No, because the nature of our methodology is an online sample, an online collected panel through Leger. We know there are certain groups that we are underrepresenting. Specifically, we don't talk about Indigenous populations. We're underrepresentative of people in long-term care. And we know we're underrepresented, for example, of people with physical disabilities. So we tend to not comment on those areas, and we don't have any indicators for group homes or criminal justice involved individuals as well. So we don't have any data on that. I'm sorry.
So there was another question earlier, maybe in the light of the fact that participation to community group are associated to a better sense of belonging or better mental health. So the question was, can you say that meaningful relationships are a protective factor for good mental health?
Yes. Can I? Yeah, no, the answer is yes.
And actually, one of our colleagues published in 2023 a study that looks at the association between people who reported having most of the time or always good relationship and their mental health indicators. And there is a strong association between people who have meaningful or good relationship and better mental health indicators. There was another one with increasing screen time, especially among younger Canadians. What are some signs or indicators of declining mental health that parents or staff should watch out for?
I don't know the answer to this question. What are signs of? So, I honestly I don't know the answer to this question. As a parent myself, I should know the answer to this question, but we don't track that information. We just don't. But I'm more than happy for anyone else who might be more of an expert on that to comment, or we'll repost it. But I don't know what things we should be
Something that I can add is that we actually looked at the mental health indicators for youth that actually spend a high amount of personal time on screens, and they were more likely to report severe anxiety symptoms, and we used the GAD-7 for that, as well as severe depression symptoms. We used the PHQ-9. So if you're interested in looking at the details of the symptoms, that would be maybe a lead to look at how it express. They're all also more likely to report suicide ideations and substance dependencies.
So I do see that a few people have pointed out to us who may know more about the subject than we do. Preoccupation, poor hygiene, poor sleep, similar symptoms to problematic gambling, which, by the way, is a fascinating subject in to itself that we will have a lot more to say about that issue shortly. But yeah, that would be irritability from the we could run more on the screeners in terms of the actual symptoms that are being identified to answer that question a bit better, but we haven't done that yet. But look specifically at the symptoms that these individuals are indicating.
Exactly. And how do the economic downturn and political tensions influence different demographic groups like age, income, region in Canada? Or there are particular groups that are more vulnerable to mental health issues in these contexts?
Yes, and I think it's a question of how it manifests for the individual. So there's certainly an individual that are highly engaged in all political topics, from international affairs to domestic politics, who regularly comment in our polls that politics is driving their mental health one way or the other, tends to be negative. But as I indicated, the current issue we're tracking about political trends tends to be concentrated among the older population and those who can't afford to pay bills.
And the last one, maybe I have two left. What role does media consumption play in exacerbating the mental health impact of the economic downturns and political tensions? And how can individuals try to mitigate this impact?
So I want to be clear that what we're looking at is we're finding the correlation, but in terms of solutions, we are probably not the right organization to identify with that. Although I would say that we do look at factors that are both negative and positive. And a simple act of going outside, and the simple act of being part of communities tend to be two of the strongest drivers that we see correlated with positive mental health. So maybe turning off the TV, going outside, communicating and engaging in a community event would be a really good piece. That's what the data tells us. But beyond the specifics of that, we are not clinicians, so we would not be advising on that. What was the second half of the question? Yeah.
You answered it. How to mitigate the impact of media on mental health when it comes to seeing the economic downturns and political tensions. And probably the last one, if I'm not wrong, in the light of limited access to a GP, a general practitioner, what are some alternative resources that or strategies that Canadians can use to manage their mental health in the meantime?
Sorry, say that again. I didn't follow the end of that question.
In the light of limited access to family doctors, what are some alternative resources or strategies that Canadians can use to manage their mental health in the meantime? And I'm thinking maybe community services that are also
Oh, so in light of the fact that they're waiting for supports and services, what can they use in the
in
meantime
light
when
of
they
the
need
fact
help?
that people that don't have a family doctor basically
Okay.
and face
What-
mental
what-
health and substance
Yeah,
use
yeah, yeah.
challenge, where can they go?
Well, there are free resources available to people who can't afford it and may not have access to a family doctor. The quality of those resources does vary, but there are navigation sites, specifically if you call 988 for mental health supports. They are pretty good at directing you to free, and you indicate you may need help. I would call 988. I would look, there's a Government of Canada website that points to different provincial sites, which help people navigate to free resources as well. I just want to make sure that if you're going to access a free resource, please do so by those that are at least studied and some validation has occurred, which generally occurs if it goes through one of these centralized systems, because I know there are some services that are not as quality as others. So for those who don't have access to a family doctor, don't have access to benefits, I would start with 988, or there's a Government of Canada website that actually links to the provincial websites depending on where you are. So Connects is Ontario. There's a number of them in Ontario as well. If you're Youth Foundry, IYS sites, Youth Wellness Hubs Ontario, Huddle in Manitoba are really great places to go. So yeah, someone also posted the Canada Mental Health. I'm going to steal that and post it to the chat. Thank you, Natalie.
Yes, and we actually studied that youth accessing community services report quite a high level of satisfaction. So I don't think I see more questions, and it's actually time. So thank you to those who submitted your questions in the chat. Thank you as well. Michael, do you have anything to add before we end this webinar?
No, I think that's more questions than we've ever received. So keeping me on my toes. I appreciate all the insight and all the insightful questions. I'll post my email in the chat. If anyone has any follow-up questions that we didn't address, by all means, reach out at any time. And we'll be starting our Poll 24 collection soon. So our next set of collections coming up shortly, we'll be doing the Omni study, the one I talked about specific groups moving thanks to economic tariffs and economic war. And then next week, we'll be launching with our partner Green Shield an interactive hub that looks at youth. So really excited to be work on this interactive platform that we'll be launching shortly. I would ask anyone who wants to be informed on these subjects to subscribe to our email list so that you can get all this information as it comes out. We'll try not to spam you. Yeah, we're more than happy to take your questions. Thank you all for the questions. It helps us think about where we go next with some of these topics. So thank you for all your insightful questions.
Thank you all, and we have several reports coming out this spring on exactly what we pointed out: youth mental health and screen time, along with gambling indicators as well, and other interesting studies. So as Michael said, please register to our newsletter. You will have new reports regularly. Thank you all for participating to this webinar. Thank you, Michael, for presenting these findings.